These are the warning signals that each and every one of us ought to be aware of, particularly if you or someone you care about is coping with diabetes. Imagine if diabetes is a stealthy guest that comes to visit us at night, always keeping us on our toes. When the sun goes down, it has the potential to bring with it some odd friends. Having the ability to recognize these signs is comparable to being able to navigate your way home in the dark. Therefore, because diabetes never takes a rest, let's take a look at 4 potentially serious indicators that appear after the lights go off. Number 1. Sleep apnea. The sleep condition known as sleep apnea is defined by interruptions in breathing or short breaths that occur throughout sleep, which ultimately results in frequent awakenings. Those who have diabetes should be especially concerned about this since the disruption of their sleep and the decreased oxygen levels can both lead to insulin resistance and poor management of their blood sugar levels. Obesity, which is also a risk factor for type 2 diabetes, can be a cause of sleep apnea, which can be a symptom of insomnia. Alterations to one's way of life and medical procedures are frequently used in conjunction with one another to treat sleep apnea. Because even a slight drop in weight can reduce symptoms, weight loss can be a very useful medication. It is normal practice to utilize continuous positive airway pressure, CPAP, equipment to maintain open airways while sleeping in order to provide quick relief during sleep. Alterations to one's lifestyle, such as abstaining from sedatives and alcohol, both of which have the ability to relax the muscles of the airway, can be useful. Sleeping on one side is also suggested over sleeping on one's back in order to avoid obstructing the airway. The efficient management of sleep apnea and diabetes can lead to improved blood sugar levels and general well-being. This is relevant because of the interconnectivity of the two conditions. Number 2. Night sweats. The most common symptom of night sweats is excessive sweating while sleeping, and this can occur even when the temperature in the room is pleasant. These severe sweats can act as a warning sign for nocturnal hypoglycemia, which refers to low blood sugar levels throughout the midnight hours when it comes to diabetes. It is possible that this is caused by a number of different triggers, such as particular drugs, severe insulin treatments, an imbalance in the meals that are consumed on a regular basis, or strenuous activity in the evening. Not only does waking up wet disrupt a restful night's sleep, but it also serves as an indication that the glucose levels in the body have dropped to levels that are cause for concern. When it comes to effectively managing night sweats, it is essential to monitor blood sugar levels on a constant basis, particularly in the evening. The identification and modification of possible triggers can be of great assistance. In addition, it is possible that the doses of medications may need to be reevaluated under the supervision of a qualified medical practitioner. Having a glucose source that is easily available, such as glucose tablets or juice, by your bedside could save your life in the event that you have a drop in glucose levels throughout the night. Number 3. Nocturia. There is a possibility that the term nocturia is not well recognized. Nonetheless, the repercussions of this condition are undeniably disruptive, particularly for those who have diabetes. The presence of this symptom indicates that you are urinating more frequently during the night. Diabetics frequently experience this symptom as a result of elevated blood sugar levels, which occurs when the body makes an effort to eliminate excess glucose through urine. When a person wakes up often during the night to use the toilet, not only does this cause a disruption in their sleep cycle, which in turn leads to feelings of exhaustion and a decrease in their alertness during the day, but it also acts as a strong signal that their blood sugar levels are not within the appropriate range. There are 2 primary approaches that might be taken into consideration by folks who are looking to control this nightly issue: monitoring and controlling the levels of sugar in the blood on a constant basis. It is important to pay attention to the amount of fluids consumed in the late hours. If the problem continues, however, it is very necessary to seek the advice of a medical expert because there are a number of additional conditions that might be contributing to nocturia. Number 4. Frequent thirst during the nighttime. For many diabetics, a telltale indicator is to experience frequent thirst throughout the nighttime hours, particularly when their blood sugar levels are rising. In order to flush out the extra sugar, the kidneys create more urine when there is a high concentration of glucose in the circulation. This causes the cells to deplete their water supply. As a consequence of this cycle, the individual has increased thirst and frequent urination, even throughout the night, which may cause sleep disruption. There is a close connection between the effective management of this symptom and the overall control of diabetes. Maintaining a healthy level of blood sugar is of the utmost importance. Under the supervision of a healthcare expert, it is vital to monitor glucose levels and make appropriate adjustments to the doses of glucose medicine or insulin medications. Hydration is essential, however, in order to ease the disturbances that occur throughout the night. It is best to strive to maintain a balanced fluid intake throughout the day rather than ingesting excessive volumes of fluids in the evening. Caffeine and alcohol are both diuretics, which mean they can increase the amount of pee that is produced. Cutting back on these substances can also be helpful. The ability to identify and handle thirst during the night is of utmost importance, since it is not only an indication of high blood sugar levels, but also has the potential to disturb restorative sleep periods. The first step toward optimal diabetes management is being familiar with these symptoms. Your overall diabetes control will be strengthened as a result of this, in addition to improving the quality of your daily sleep. If you found this video to be useful, please consider subscribing to this channel. I appreciate you taking the time to watch.